Oi, boa noite no nosso caso, bom dia, boa tarde, como estão vocês? Estamos de volta com o nosso terceiro episódio. We're back with Setcast third season in English, first season in English, actually third season.
We're back now?
We're just back now.
Oh, okay, because you're speaking in Portuguese.
That's the idea.
Yay! Vamos começar? Bora começar? Let's get started, guys!
Let's get started, guys. How are you?
Oh, yeah. How are you today?
All right.
How are you?
I'm good. I'm very good.
How are you?
How are you?
We're good.
Yeah.
Right? Thank you.
Oh, relaxed?
I'm relaxed.
Oh,
yeah.
I'm
Feeling
really it's warm and comfy here.
Yeah.
Today we have this brilliant woman, this amazing woman. She has so much to say to people that actually want to work legally here about how the process has been going on, updates on everything, and the market itself. She's a dentistry and she's specialized in canal surgeon, or?
It's like root canal.
Root canal, which I clearly don't understand the difference. So, yeah, so this woman
So
can be
yeah,
here today.
that's why
too.
she's here to explain,
Yeah.
it to
Yeah.
us. You know, like, it's gonna be alright. We hope so.
Yeah.
Yeah, we're gonna be
Yeah.
fine, yeah.
Thank you, Larissa, for coming today. It's a pleasure to have you here and to understand a bit more of how to get started with something that it's like it's a really interesting field and it's very important too.
Very.
Especially if you are like you have pain. I'm lucky enough, I think, not to have this like sort of problems of cavities or whatever.
Yeah.
But I saw people around me like crying, not being able to sleep. And I mean, Larissa can talk more about what she's doing now. Currently, you're studying, right?
Yeah, currently I'm not studying actually, but I'm like working in the field of dentistry. Nowadays I do teeth whitening at White Smile Dental, which is like amazing place to work and is an amazing opportunity to practice dentistry. Even I didn't like, I'm not in the dentistry council yet, but if you don't have like your degree outside of your country, example Brazil, you can still work in your field of study if you want.
You're a graduated dentist in Brazil, right? Like how many years of experience back in Brazil?
Yeah, I am graduated in dentistry in Brazil, but here I work as a dental nurse.
Yeah.
Yeah. So
No, but you're in the process of becoming a
Yeah, you're gonna study
validating
for
your
like
diploma. You're gonna study for it.
yeah, I'm in the process. You know, it's a very long and hard process. And like, if I need to do a device or advise someone, you need to have like all your documents, diploma and translators. What else?
so you have to have
Your
all the
record,
documents.
everything, the academic record. And yeah.
So it's basically a pain in the ass. Yeah,
Yeah,
it's like there's
probably.
loads of documents and like you have to translate it and you have to send
Yeah,
it
but
here
then-
and there and wait.
But then when you get to do it, then you can work as a surgeon here. So it's worth it.
So yeah, basically now I'm in the process. I already have all the documents and I'm thinking about Portugal or Spain, where it's easier, you know.
Oh, that's true.
Yeah.
Because I know a dentist back in Portugal, and I used to pick him up at the airport, from the airport to the airport, and we'll talk about it, like how it works over here and in Portugal, because he's graduated in England, if I'm not mistaken, and he's also working in Portugal, so he can work over here. And he said that the insurance, for example, it's really, really expensive. Yeah.
It's very expensive. We need to search everything before we start. We need to search where do you want to validate your degree, or to be aware of every expenses because it's very expensive.
It's very delicate too. Like, let's say you make a procedure. What's the name? Procedure, like a surgery or whatever, and you take the full responsibility. If anything is wrong or over there, anything can go to court easily. It's really tricky, and sometimes because of that, according to this dentist, he said to me that people don't do it. Like the dentists, the professionals, they rather not take the case. So I mean, sometimes you gotta take care of the situation, but you can't. Like, is it true or how does it work in real life?
Yeah, it makes sense. It's like when you come here to work like a dentist and you can't work really like a dentist, you can choose like to work with high aesthetic procedures or go into a dentistry, and you need to validate as well. But if you choose to work like a high aesthetic, you need to pay an insurance.
Yeah.
It's like an annual insurance. It's very expensive, but you'll be like working safe.
Yeah.
And if you want to work as a dentist, you need to pay as well. It's one expense.
Interesting.
Yeah.
And you're studying because you are seeking to follow which specialty in the area, let's say?
Yeah, I would like to come back doing root canal.
Root canal, yeah.
That's my master, and that's what I'm passionate about. I really love it.
And she said she's not afraid of seeing like the whole thing like screwed up,
Disgusting.
But like
She
the
said
rest
it's
of the body,
fine. Whatever that happens in the mouth, if it's cut or if there's a problem, it's fine. Or if it's open, but there's a bleeding up open wound,
Yeah.
She can't stand that.
Why? What's the name of that again?
I don't know.
In Portuguese, you said like
Viadagem.
That's it, viadagem.
Gente, também faço parte da comunidade. Eu tô brincando. Disclaimer, pô.
This water is really good today. What about you? You have like many questions for our guests. Like you have like a list, a huge list.
I do have a list.
Sometimes I call you Schindler.
Did prepare a list. Yeah. One of them, as you mentioned, aesthetics. I kind of wanted to ask you a bit about it because last time we spoke, you said you were studying it, fillers, and what is something botox. And as you mentioned it now, I mean, I was just wondering, are you working with it? Because I am interested in that area, and I would love to hear what you have to say, why you like it. I assume it's something that obviously it's profitable. What happened in your life? Why did you decide to go and study this? And tell me that then your price is later on. We can talk about it.
I know why you're interested in that. And I have done like lip fillers and Botox course. I have done lip fillers here in Ireland and one Botox course in Brazil. And I have done this course because, I have two options. If I don't validate my degree, I still can work like an high aesthetic practitioner, like doing injectors, lip fillers, acid hyaluronic, and Botox. It's allowed because they don't still have one law that says, you can't work like a high aesthetic practitioner, or just dentists and doctors can work with this.
So Larissa, I was thinking here, what about the regulation in Ireland and in Brazil? What's going on about it?
It's like kind of, they didn't decide yet, like only doctors and dentists can procedure and allow it to do injectors. But like in Brazil, it's something that's going on, and they decided like nurses, biomedics, like everybody can do like pharmacy. If you're on the field of health, you can do, And here it's different. We have high aesthetic field and the dentistry field. And if you want to choose for high aesthetic field, you are allowed to do that.
Mm-hmm.
But you need like a prescriber.
Okay.
We have a lot of requirements to follow.
Bureaucracy.
It's like a bureaucracy. It's like the boring
That's
part.
the name, yeah.
It's the boring part. But you need to follow these requirements. You need like one prescriber. That's the most important thing. Then we need an insurance. And usually you need to pay 1 year, and they ask you 6 months of experience before.
I know that the insurance usually is really expensive. I don't know, 20,000, 30, whatever. Like it's depending on the situation, the profile of the professional. Anyways, do you need an insurance for that? What you're doing currently?
So they don't provide it for me. I need to pay by myself. It's very expensive. It depends what we include on it. And if you include injectors, surgery, like if it is very dangerous, it's going to be like very high.
Yeah.
It depends on the complex of the procedure you're doing. So for me, it's like 1,500 euros.
Oh, it's okay.
It's okay.
Yeah. It's like a car. It's cheaper than the first insurance for a car here. Sometimes it's like 2,000, 3,000.
Yeah, but it's like working like an injector.
Yeah.
But if you are a dentist and doctor, it's higher.
Way higher.
It will be higher.
Yeah.
I was curious to know why you became specialized in root, whatever the name it is. Because it's something so specific. And it seems like people, I don't know, not many people actually do it. You must really like it. So what is the curiosity about it? It's a job that you do like in several parts and stuff, so you gotta like it.
Oh yeah, most of dentists hate this procedure.
Yeah.
That's why I choose that.
Because people hate it and decided, okay, I'll go for it.
Yeah, go for it.
Okay, that sounds like
the
me.
challenge.
The clinic I will use at work, they asked, who wants to do the root canal? Silence.
Oof.
And
That's me.
Yeah.
I watched Dexter.
Yeah.
Like, all this.
I like challenging. Yeah, that's me. I'm the girl.
Nice. So you actually enjoyed it at some point, or you went for the challenge.
I went for the challenge.
You liked it after.
That's good because this is like usually what people most need. Like they're desperate. They need a canal root.
Yeah, people are desperate for it sometimes because they don't know before.
Yeah.
Few people know it in advance. They can figure. It's just like
it starts very small. It's just a decay, and I wait 6 months and now looking for a dentist. And that's the problem. In 6 months, you can get a root canal. They think, that's not a problem, but
6 months only. I didn't know. I wouldn't know. And what are the first symptoms?
Fast. Pain, very painful. You start getting crazy.
Where do you feel the pain? Up, or is it head, or is it? What do you feel? Just everywhere. The teeth, or
it's everywhere. It's like I'm gonna say pumping when you eat something cold. Could be hot as well. It depends on the stimulus, and you feel very, very painful. And that's the thing, they can't escape. They need to do the treatment.
And sometimes that happens on Saturdays. Like, and the clinic is closed. Not joking.
Usually it starts when the clinic's closed.
Yeah, it's horrible.
Yeah.
It's horrible.
Has it ever happened to you like this?
Not to me, but like to my wife. Oh yeah, I've seen like her like crying all night long and going to the hospital. We went to the hospital. Nobody does anything like late night here. You have to wait till the next morning. So and then you don't have medicine like pain.
If you have
give them paracetamol. Is what the doctors here do.
Exactly.
When you're sick.
Thanks, doctors.
Give paracetamol. I broke my arm. Paracetamol. I have appendicitis. Paracetamol. I know what I'm talking about because I know 2 cases that exactly that's what happened. So give
Yeah, I know.
paracetamol.
I know many more cases like with
I know two for
paracetamol
a fact.
too. Yeah,
Yeah.
Yes. A broken
Anyway.
arm and for appendicitis.
we kind of need doctors here. If you're watching this somehow for some reason, please come to Ireland.
There are a few good ones here. Very few. Very few.
Yeah,
Very few. Most of them are not Irish. So
yeah. Their surnames. You just see by their surnames. Oh, this is really good. Yeah.
Oh, the surnames?
the surnames of the doctors.
The doctor there.
Oh, the doctors.
Yeah. Oh, Santiago.
Você falando merda.
No, but that's something interesting because, when I go to the reception and call my patient, can you guys imagine how hard is it?
Yes, probably.
Because I read the patient's name and it's an Irish name.
It's tough. It is
It's
tough.
really tough.
Yeah, but and how was that like for you in the beginning? Because imagine you coming here first day. How was the first day like?
First day was, God, I'll be fired. I'm pretty sure I'll be fired because I was the reception. Hey, Isha, come here.
Isha.
Hey, please, I don't know, like Aaron. But I had no idea
It's very tough.
what I'm stuck.
Siobhan.
And it's Siobhan.
Saoirse.
It's Siobhan.
Yeah. Owen. Their Owen here is different.
Yeah, there's one that is very, very tough.
And I can't
Quiff.
remember now, but
Quiff?
Quiva.
Quiva.
Bronya. Quifa.
Quiva.
Bronya.
Quiva não, velho.
I've had some
the way
friends
we
with those.
speak is
It's Quiva,
completely
yeah.
different
Quiva.
in the way you read it.
Yes, that's it.
Sorry, guys,
It's
yeah.
completely
And
different.
that's it. And sometimes I call on the reception and nobody show up. And I know I'm talking like, very wrongly.
So I wanted to ask you, you currently work in a clinic with what's the name of it? Whitening.
Whitening, yeah.
So you kind of see people in the clinic, you kind of see how things are going on, and you probably noticed differences between how things are done here in Ireland and back in Brazil. I was kind of curious to know the differences that you might have noticed.
Okay, so it's a complicated question. The difference, like, in related to materials, they are the same. Completely the same. The way you do and the way you act is exactly the same. But patients are a bit, it's a bit different. When you're with a Brazilian patient, you talk in a way, and if you're with I don't not talk of Irish patients, but European patients at all. The way you contact and interact with them is different.
It's very little.
It's like little.
Mm-hmm.
Like this
Don't
little?
speak too much.
Yeah.
This little.
This little maybe.
Yeah.
Yeah.
Hi, that's it. That's it. The options are those. One or two. There, now. That's it.
Yeah.
Straightforward. It is what it is. If you don't do that now, you're going to have to do that later. Or you're gonna... That's it. In Brazil, no, you kind of have to talk and do like taxis, drivers, and psychologists, they say. Do like become a bit psychologist, they say that.
Kind of. You talk more, you interact more, you can be funny and say things and you don't mind what you're really talking.
Yeah.
But if you're with these kind of patients like here, Irish and Europe patients, I think it's because something cultural. They respect a lot dentists here. And I can't complain because I really feel very respected. When I'm attending,
even though you haven't actually you're not fully working with us, but you are already respected because they know you worked with us in Brazil. They know you are. You just can't work here for now, but they respect you for that. That's crazy.
Yeah, exactly.
But maybe like when the moment of this episode airs, she is gonna have some.
Yeah, maybe.
I don't know.
Maybe she's gonna already have it.
What do you think?
Validated stuff, yeah.
Yeah, maybe. I wish. Yeah, I really wish.
And then when we're gonna do it, we're just gonna write down she got it.
Yeah, yes, it's something. Just
Hopefully, let's see.
Waiting for, I'll have some answer in January or February. If I'm in the university.
Nice.
Yeah, things crossed.
Yeah. Nice.
Yes, it's very nice.
Something to be very proud of as well.
Yeah.
It's quite of an achievement.
Yeah.
Many people want to do something like this and they just, sometimes it's tough, yeah, but some people just don't pursue enough.
Yeah,
they do have opportunities and they don't pursue enough.
We see loads of opportunities over here, like in many areas. But it's just like about somebody telling them like, hey, you can do this and this and this. What do you think? And they're like, oh, really? I can do that?
Yeah.
Yeah, I can do that, man.
Yeah. People in general, yeah.
Yeah.
Yeah, we need to search, nowadays we have YouTube and a lot of things where we can search for that. And
I became a carpenter because of YouTube. Like, carpenter for myself, but I built a chicken run and a few things like that. So I think that nowadays the access for information, for knowledge is way easier, and that's the problem as well. Because sometimes it's too easy, it's just there, and you're like, okay, so it's there whenever I need it.
yeah.
But then you're like, yeah, you need it now, you don't realize it. Use it now.
Yeah, things going very fast nowadays, and you have a lot of information, and at the same time, it can be confusing about all information we have. It's related on validation as well, because I have tried before 2 advisors. I have paid it, and it's expensive.
It is. Anything here is expensive, like any professional.
Yeah.
And just in the end, I found one advisor about validation, which is really good, helped me a lot with the process. And it's the better thing you can do is search before.
Yeah. But do things change like quickly in your area? Like new technologies, new information, new awareness. How does that work for you?
Oh, it changes a lot. You need to be updated about the trend. You know, it's sometimes a lip filler and then it's botox and hyaluronic acid and
and the techniques,
everything's changing, and you need to pay for one more course, But it's amazing because it's on top. Everybody wants to do an harmonization.
Yeah, everyone wants
to feel like younger.
Yourself,
you want to feel better. You want like self-esteem.
I agree.
It's so good. Yeah, you feel good with yourself.
Yeah, it's been a while I don't do, but I just love the PDO.
The PDO?
I love it so.
What's the PDO?
It's a collagen something that they stick in your face and then it releases and helps you producing more collagen so you look younger.
You look younger. Oh, this is amazing,
Sounds very painless. It's really...
Well, let's speak. There's whole beauty industry shit, right? I'm not going to go into that now.
Yeah.
What I'm saying is, for me, it works that I like what I see in the mirror. Period.
Yeah.
That's it.
I know.
I like
as long as you're helping patient, it's good. Just don't be crazy about it. Don't compare yourself all the time. It's something to help, not to feel bad with yourself.
It's to enhance you, not to try becoming something you're not. Maybe not to lose yourself in the process.
Don't lose yourself in the process. Like just trying to be yourself. Don't change everything on your face, and you can't be recognized anymore.
Yeah, that's something that happens as well. Yeah.
Yeah, but was there any occasion in which you saw a person that would do, like, they wanted something extra that you wouldn't go further, like, no, this is not healthy? Did you have this situation already or not?
No, she's studying.
Oh, she's...
Actually, yes, because I have some patients, they all week to do whitening. They want to do whitening every week, but it's not healthy.
Exactly.
They can't do that. We need to wait at least 3 months to do again, like a top up. So yeah, we have patients addicted to whitening.
Mostly from where?
From here, from Ireland. Yeah.
Wow, that's crazy.
So it's whitening and
Americans and Irish people.
Yeah. So you think Americans, they want the Hollywood smile? It's not like just a stereotype.
That's not a stereotype, and I can say this is something that is starting to be viral. Everybody's want to do lens and veneers. But most of my patients that are addicted to whitening and procedures, they are Americans, and we have some Irish population as well. But, we need to take a time, just like 3 months at least, to do a top-up.
I didn't know that. Never done before, to be honest. You can see it. What about you, Mara?
Just
have you done before?
There. I'll give a discount. I can do a deal for you.
Oh, yeah.
I have to do again because I've done it 3 times in my life. When I took the braces off, and then when I took the braces off again, and then recently, but not that recently. So I have to do it again.
Oh yeah, take a chance. Go there. Yeah. It's really good. Yeah.
Go there, woman. Don't be shy.
Yeah.
Don't be afraid.
We have some difference, because my room is not like a dentist room.
Okay.
Like an high aesthetic room. I don't use the regular dentist chair. It's a high aesthetic chair. And the problem is you need to control your saliva. You will be with the cheek retractor. And we don't use suction. Sorry, guys, I don't want to scare you.
That's very tough, huh?
Yeah, it's
very tough.
You want to do it, Mara? We can make a video for Setcast.
Oh yeah, let's do it.
Let's do it. We're Setcast.
Yeah. Can you have an idea?
That's gonna be very pleasant. Yeah, let's go for it.
Go for it.
Oh, sorry.
No, but it made me think twice because it's actually tough. Because there's no way of talking it to, you're gonna be drooling.
Yeah.
And then you get a towel, a body towel, and just go on.
I'll not be there all the time. You'll be by yourself
thank you very
there.
much.
I just say, I put the acid, the cheek retract, and I say, just relax and swallow.
Yum, yum, yum. See, ladies, always swallow. What? Pause. I said always swallow. So I'm joking. Never swallow.
That's a very interesting sentence.
And I leave.
I've heard this before.
Yeah.
In a different context.
Maybe in a different context.
Yeah. So never, right? Anyway.
Okay, but come on, it's insane.
That's insane, but
Okay, but it works.
That's the way it works.
People come back.
People come back, and I think
they pay for it. Can you believe it?
They pay for it. They come back. I think they are happy.
Just relax and swallow.
Relax and swallow.
Oh man, I like it. Oh, Setcast is just the best.
Sorry,
we gotta focus.
Sorry, Mom, Dad. I think you're hearing that,
but it's a joke, guys. Come on.
It's just a joke.
Yeah. It's okay. It's a joke. Please don't cancel us.
Yeah, we're fine.
Do we have more questions, Mara?
So yes, actually, I do. I was wondering, because you had different experiences back in Brazil with different people, different ways, behavioral, cultural, and then now you're dealing with every kind of personality and nationality that can actually go there. So it's very different. there are differences there. So I would like to know, what do you feel about the cultural differences? Because you're talking to the world now, and people are different by culture, and of course they have personalities and stuff. And something that I think it's kind of according to this question, what is the most interesting sign of appreciation that you can think of you were shown, or a very nice situation that you wouldn't expect, something nice that happened within this new journey that you're just starting?
Oh, I think the most like rewarding thing is the compliments. And I just had done one teeth whitening, and the one patient just let me know, oh, I'm pretty happy with the result. And they like compliment, very good.
It's comforting.
It's comfort.
Yeah, your ego likes it.
Yeah, I feel very proud, and I'm doing I'm in the right way. And it's something here. You got chips.
Yeah.
What do you release in your brain, like in your
The rewarding center.
Yeah.
Dopamine.
Yeah.
That's probably it.
I think so.
I don't mind if they give me a
Dopamine
tips.
is something
Just
else.
doped on dopamine.
Which is awesome, because you're dreamy and you're like, okay, you're feeling revigorate somehow, and you're feeling
Yeah,
it energizes you and
really
makes you keep doing it. Of course, you're getting a reward. Yes.
It's really important for us,
Yeah, and
then people are
also
happy.
the reviews. They just go to Google and they write what they think about your job, and this is amazing,
Please.
This is something here is that we don't have in Brazil much.
Yeah, we don't have in Brazil much,
It's
but
culture.
they really do that.
Yeah.
They do the reviews.
In Brazil, we can't rely about the reviews. We don't know if it's fake or not, Over here, it's like people, they take their time to review. If they like it, they really do like it. They're like, I really need to let them know, because they have to keep up with this standard.
Mm-hmm.
Because sometimes it's really hard to get like a good service here in Ireland. And when you get it, you just want to marry it.
Yeah.
Something like
I
that,
just feel like a good feedback and
Good
like
professional,
it's professional thing. It's really good.
It's really important.
And what about the cultural differences?
All the difference in cultures, we have a lot. I think Brazilians, they brush their teeth more frequently.
Okay.
As we bath.
But is it like good? Is it healthy to brush this much or not?
It is.
Oh.
It at least 4 times a day. When you wake up, like before or after lunch, after you eat something in the afternoon, and before go to bed. That's the most important. And here, usually when I ask my patients, they have to brush their teeth just once a day.
Wow.
Yeah.
Wow.
And it's a huge difference. I'm not talking about like nationality. I talk about like Europe at all. They just brush once a day.
Yeah.
It's really true.
Okay.
But have you seen like the instructions in the toothpaste?
No.
But like to brush a bit like 1-2 times a day over here. I read that. I was curious.
What is it different in Brazil?
It is. It's like 3 times.
In Brazil?
Yeah.
At least 3 times.
And I always thought more than 3 times would do harm. So, although sometimes I do it, I always thought someone told me it would remove the schmouch. Schmouch. This word goes in English.
Of the animal. Once I just brought my toothbrush to my work. Not this work, other work. I have worked before. And I was there on the path to go to the bathroom to brush my teeth, and they asked, what are you doing? Why are you brush your teeth right now? It was like really weird for them.
Yeah. What did you say? Like,
Let
let me be clean, please.
It was
I think we all been there.
Everybody was looking at me because I was brushing my teeth on the bathroom.
Yeah.
Yeah.
After lunch. They
And
don't
then
do that.
when you're working in companies, when you see someone brushing their teeth, there's a 50% chance there are Brazilians, and then there's a couple of other nationalities that you do know they do as well, mostly from South America, and you kind of think, okay, it might be Brazilian, might be Latino, Yeah.
It might be.
Yeah, of course.
Very high
That-
chance.
But do you see that like as a positive thing? Like you're bringing this kind of information to patients, local patients,
Yeah, of course.
and they're getting this positive feedback. Are they receiving it in a positive way, or are they like, no, I don't want this information? The way I do it's okay, or they are just like, we never had this education before. Thank you for coming here and providing this information for us finally.
I think they are becoming more conscious about brushing teeth and gum healthy at all.
Yeah.
And they don't take it badly. When I'm talking with them, they are really interested about like everything, like non-healthy, you know.
Yes.
And I think they are very influenced by Brazilians here because we use braces and we brush our teeth more frequently.
Yeah.
And I think they have been influenced by us.
What about the dental floss? I had to bring that up. Sorry. I'm really sorry.
Oh,
Yeah.
that's gonna be a tough answer.
It's really hard for me as a consumer to find something that is good enough, that it doesn't, like break in 2 or 3 pieces or.
Oh, the dental
Yeah.
floss. Like, that's the guy. I'm not lying. I'm a dentist and I don't use dental floss this frequently, just once a week.
Me too.
That's my fault. Sorry. But we have like something here on the market. I can say it's a stick with the dental floss already like done.
Yeah.
And that helps a lot.
Yeah.
Just looking for something that's ready and easier to do,
Pick the leftovers safely
It's
and
safe,
nicely,
yeah.
beautifully done. But I mean, the amount of sugar we have over there in Brazil, we consume loads of sugar. We like our brigadeiro.
Yeah.
Speaking of which, do they have problems with sugar over here in Ireland?
They do have problems with DK and missing to know. Sometimes they have like
yeah,
No
that's
joke.
really
classic.
young
That's
patients.
classic.
That's classic,
Very.
Yeah.
Young patients with a missing teeth just in front.
I remember when I was on Tinder here, and I'm never gonna be on Tinder again, especially in here. I would, before I go and meet people, I would ask them for a smiling picture, or I wouldn't go. Because obviously, you learn when you have a problem.
Yeah.
Do you think this is a smart move from Mara? As a dentist, what do you think about it?
How can you give your opinion about it? No, but no kidding. As a dentist, what can you tell people, or could you advise people on doing or not doing? And what can you say to those people that are there pursuing their right to work in a different country and getting their visa validated, diploma validated, having to complete a piece of another college or something just to be able to actually work with what they love? Depending, like, it's very tough, but what can you say to those people as well?
I would say for everybody, don't give up. You can do that if you really want, if you're passionate about dentistry. Don't give up. It always have an option for you. Just go straight and looking for a validation. Just look for the countries better for you. Could be Portugal, could be Spain, could be Ireland. But just search the requirements and just don't give up. Yeah.
Yeah, no lame excuses.
Yeah.
Don't make excuses and don't be shy. Don't be shy to ask and
To make mistakes.
make mistakes
and learn from
course.
them.
Learn from them.
Yeah.
Yeah.
That
Don't be
means you're like
afraid.
in a process, which means you're moving. So you're going to achieve something in your life. Don't worry about it.
Yeah.
But it's going to be hard, yeah. Isn't it going to be hard? Say the truth. Like, it's challenging.
It's really challenging. Even
Yeah.
if you choose for Portugal, where most of Brazilians go to
Yeah.
validate their degree, because of the language. It's Portuguese. You don't need to translate documents. It's cheaper.
Probably faster.
But even if you choose Portugal, it's challenging.
Yeah. But it's worth it, right?
Worth it. Worth it, because dentists here, it's very valued. You can raise your salary. You're not about salary, but you feel proud.
It's about access. We were talking about it earlier before the episode. And it's like you have access to buy a house. You have access to buy a good car. You have access to
it's comfort.
Reinvest in your business, in your studies. Like you are gonna be going to studies soon, right? Like 2 years.
Yeah, I'm considering trying Portugal or Spain.
Yeah.
If I go to Portugal, I have 2 options. I can go straight for the test, or I can go back to the master. It's kind of a master with a degree together. Yeah. And it's really good because you get your master with an academic degree. But to take the test straight away, you need to have 5 years of degree and more than 5,000 hours of graduation. That's something that people make mistakes because, I have 5 years of dentist degree, but you don't have more than 5,000 hours of dentistry studying.
Yeah.
So you're not able to take the test.
You need experience, yeah.
You need experience. And if you are not into this process, you need to go back to studying.
Okay. And of course, you haven't learned.
At least 2 years.
Fair enough.
Because it's not because our study is poor. Brazil, it's far away from very countries in high aesthetic procedures. In relation to dentistry, we are very good. But our academic programming, we have less hours than them. And that's something like rules. We need to follow the rules. Mm-hmm. They have 7,000 or 8,000 hours. And we must to do more 3,000 hours.
Yeah.
That's why we need to study more 2 years dentistry here.
Yeah, that makes sense. You gotta respect the rules.
We need to respect the rules.
At least you have a chance, a way to do it,
Yeah.
Because I used to think like that, there's so many rules and bureaucracy, all stupid. But then I realized, okay, so if I really want to do it, I'm gonna fight for it. And then I'm gonna deserve it. And that's the rule. I mean, at least I have a chance to do something. I have a way, I have access for something,
Yeah.
Even though it's not my way, but whatever, man. I'm not a boy anymore. Or am I? I don't know. Yeah. Anyway, so
that's exactly what I think. That's not stupid. This is something, if you really want to do that, you do what you need.
Yeah.
If you need to study more 2 years, study more 2 years.
Yeah. If you're focused.
It's just be focused.
You have a goal,
You have a chance to memorize everything and go back in subjects. We were very young. Some subjects we didn't give the importance.
Yeah. Yeah.
And now we have a chance to do it twice. So just take a chance and make the best you can.
Yeah, true. Nice.
So Larissa, if people want to reach you out and ask more about how to validate the diploma, because they're the ongoing process. So people who want to, exactly, you're in already. You just have to keep on doing it. So how would you do? Would you give them your Instagram and they can just send you an inbox or?
Yeah, of course. Everybody who is on this way can reach me and I'll help the best I can about validation. I know a lot about Portugal process, Spain process, and Irish process as well.
Three countries already.
3 countries.
Yeah, nice.
Yeah.
Very nice.
Mitchid. Good stuff, Mara.
Good
So,
stuff.
yeah, anything we missed, I don't know. And I mean, if you want to ask something that we didn't ask here, just go and check her out, like her Instagram. You can follow her. So you can follow her process step by step. Like it's the best moment right now to take
Everything
the train.
is fresh and very
Yeah.
updated.
Yeah, she's accessible.
She's accessible.
Yeah, she's not a star yet. Like,
Yes.
like very, yeah.
Still humble.
Yeah, just follow me, guys. You'll be a pleasure to help everybody. Yeah.
Nice.
Thanks, Larissa. Thank you very much for showing up here today. I did not think we could make it with the wind and stuff. I was like, fuck, I'm not going to make it in time. She's not going to make it in time.
Yeah.
But it actually happened, and she came and she worked for us for free.
Yeah, thanks so much.
Okay.
Yeah, I just wait for my payslip because I work on the set. Okay, I have no idea how challenging it was to
Revenue.
Put the lights.
to put the lights,
Oh, revenue. Oh,
everything ready here.
Revenue.
Oh my God.
Thank you very
Thank you
much
so
for
much.
everything, and
Thank you guys for have invited me.
and we're expecting you later on. Will you
Yeah.
have everything so we can talk about it?
Yeah.
Yeah, you
And talk
see me
about your
soon.
new challenge. Probably have your own clinic.
You have me here soon. Talk about that. I have done that.
Yes.
I got this.
Nice.
Yeah. Challenge accepted.
Yeah.
Chances accepted.
Yeah.
So guys, as her, we always have many awesome people. If you checked, awesome, you checked. If you didn't check, eu não sei mais, eu me perdi no meu pensamento.
So what Mara is trying to tell us here, we're trying to finish the episode. So it's a really good one. And yeah, if you follow what we're doing, that's fine, that's great. You know what we're talking about here, what's going on. And if you don't, I mean, you still have time. Just go there and check it out. Thank you.
Ai, eu tô me mijando, cara.
What's your favorite food? Não, brincadeira. Okay.
I wanna ask if you... Okay.
If you wanna be my lover. Vanessa Carlton, 1,000 Miles.
Yeah, sometimes I want to put like a Brazilian song, but I feel very weird,
Why?
I just feel weird to put some Brazilian songs when with patients here. Just
You can't
feel
stop
it's
losing
very
yourself. You
weird.
can lose yourself in the process of anything. Yeah,
I just use